Okay, this is your last review, and this is for your final exam, and this is going to cover Module 5, and it's for the last chapters of chapters 11, 12, 13, and for some of the previous chapters. So I'm going to repost where you can look at the previous chapter reviews also if you need those. Also, I'm going to post a taping video because you're going to have some questions on your final exam on how to tape an ankle, and that will be in this also in this review. So let's get started. Okay, here are some important terms you need to know. Athletic trainers like physical therapists and physical therapist assistants and doctors have to take something called SOAP notes. And this is where we take notes on our athletes when we're in the athletic training room. And we write down what the athlete tells us, and this is subjective. Then we write down what we observe, and that's the objective part. And then the assessment part is what we find out from our physical exam. And then the plan part is how we plan to make them better. And then we write that down through how we plan to make them better with the exercises and things that we plan on making them do. Arthrography. This is a visual study of a joint with an injected oblique dye. I just had one of these, in fact, done a couple of weeks ago on my head, and that was for migraines. You can also have them done for shoulders, backs. You can have them done for many number of things. Mainly, we use them for shoulders, or if they're looking, if they want to look to see something in the neck area or something in. Sometimes they'll look in the knee. A lot of times you don't need it in the knee. Um, some or the hip. A lot of times they'll use it in the hip to see if you've got some kind of labral tear or something along those lines. Springy block. This is when we're talking about if you've got, let's use ACL for an example, an abnormal infield. It's going to have a springy feel. You'll feel it, but it'll feel kind of springy, and it doesn't feel like it's supposed to. So you know that they've got some kind of tear in there. It may be not a complete tear, but it is a tear. Sequela, I'm not sure if I said that right. This is conditions following or resulting from disease or injury. The brachial artery, okay. This is the most common pressure point in the upper extremity, and it's up in the arm area. And this is what we use to control bleeding. So femoral artery is the one we use in the leg, okay. So let's say they get some kind of cut on their arm and we need to control the bleeding in that area, then we may use some kind of material to cut that off to help control the bleeding. Hypovolemic shock. This is trauma in which there is blood loss. And they'll go into shock, and we'll discuss shock here in a little bit when we start talking about on the field, off the field evaluations. Anxiety. this is common mental or emotional stress producer. Meditation, mental training used to quell an active mind. This is meditation used to help slow down your thinking and make you help, have healthier, easier thoughts. All right. A lot of y'all may not know the steps for CPR. Let me see. First of all, for CPR, the steps, we may need to make sure the scene is safe. We already have one victim. We don't want any, and we need to make sure that the scene is safe. And because if it's not, then, if we've got two, that's too many, okay? So if we can't help them, then, that's, a lot of times I may be the only one there that knows CPR. So if I'm hurt, then I can't help that person. So I want to make sure the scene's safe. All right, I'm going to tap them and I'm going to say, "Are you okay? Are you okay?" And because, hey, they may be just taking a nap. Who knows? All right. Then I'm going to tell the nearest person to me, "Hey, call 911. Get the AED." Okay. Then I'm going to check for a pulse. If you can't find it, you find the Adam's apple and then slide over to the side. I'm going to check for 5 seconds, but no more than 10. I'm also going to lean my head down toward the mouth. Now I'm going to look down toward the feet, not the other way, because I'm looking to see if the chest is rising the whole time, and a feeling for the breath on my cheek. All right, and I'm gonna, like I said, I'm gonna do that for 10 seconds, or no more than 10 seconds. And if I don't feel anything, then I'm gonna begin CPR, and I'm gonna start with the compressions, and I'm gonna do that in the middle of the chest, right at the nipple line. Okay. And if it's a female, you may have to cut the bra off. All right. And believe me, they'd much rather be naked than they would be dead. You can always cover them up with a shirt or something. But you're gonna give the compressions at a hard, steady beat, about 2 inches down for an adult. About 1.5 for a child, and you'll do 30 compressions and then 2 breaths, and you're going to continue this until an AED arrives, or you've done 5 cycles of CPR, and then you're going to recheck for signs of life, and then you'll begin CPR again if needed. You'll do this until either somebody with more training than you arrives, you become too tired to continue, the AED tells you to stop and give a shock, or the ambulance is, there, or they start showing signs of life, or you're just too tired to go home. All right. On the field, off the field evaluations. Athletic trainers have to make decisions, about serious injuries all the time. So what we have to do is we have to decide, do they need to be transported? Is this a shock type of situation? What do we need to do to treat this? Do we need to put, like, if it's in a heat related situation, do we need to put them in a cooling tub? Do we need to use a rectal thermometer? What do we need to do? How do we need to do it? How fast do we need to do it? We're put in these situations every day, and we need to make these decisions quickly. It's not something that is that is taken lightly. We are trained for this. This is something that we go to school for, okay? So when we're on the sidelines, we need to make sure that we're paying attention and that we know the mechanism of injury, if it's an injury type situation, or if it's a heat related type of situation, or what is going on. We need to know their medical backgrounds. Are they sickle cell? Do they have? Do they carry the trait? Are they diabetic? Are they asthmatic? What type of situation does this athlete have? And you need to know what to do with this type of injury um, in order to make it better. So we need to know what to do in this emergency situation on the field, off the field, in order to handle it. Okay, and sometimes even if we do know, certain situations can mimic others, like hyponatremia. It mimics both concussions and heat-related illnesses. So you may think that they're dehydrated where they're overhydrated. And you may give them water where you need to not give them water, and they need to be getting more salt or uh, electrolytes and type things and less fluid. But it's hard to know with those types of situations because we don't go home with the athletes. So it is hard to know in those situations. But when an athlete goes into shock, you need to know how to treat. They used to tell you to put their feet up. Now they say, don't lay them flat. Don't give them anything to eat. That is normal. You want to make sure they're going to have a weak, rapid pulse. They'll be sweaty. They'll be pale. They'll most of the time not talk. If let's say they're diabetic and you don't know whether or not their sugar's high or low. Well, you've got to know that person and what symptoms they have when their sugar's high and their sugar's low. Some people are different. I have a friend that when her sugar is low, she'll go into almost a diabetic coma. Whereas when it's high, she's fine. You can't tell anything is wrong with her at all. So, you just got to know the different types of symptoms and what's going on with them when when what's happening is happening. All right. So let's talk about taping an ankle. All right. How to tape an ankle. All right. So what you need is tape adherent, heel and lace pads, pre-wrap, and white athletic tape. You need to make sure that the area is clean. Then you'll spray it with the tape adherent. You'll place the heel and lace pads. You'll cover the area with pre-wrap. Then you'll start the tape job with your horseshoes and stirrups in an alternating pattern that's called a basket weave. Then you'll alternate the heel locks and the figure eights, 3 on each side. And then you'll close it up after that. Now, I have a video that I'm posting on YouTube, and I will get that out to you so that you can watch that, and it'll tell you exactly that. But these are the steps, and there will be questions on your exam in a discussion. And so I want you to be able to tell me about that. And here are some more discussion questions that will be on the exam. The flash to bang method, sprain versus strain, what are OSHA and HIPAA, static versus dynamic stretching. And when I say discussion questions, guys, the discussion questions need to be more than 1 or 2 sentences, okay? These are discussion questions. So discuss, okay? All right. And good luck on your exam. If you have any questions, please feel free to ask me before Sunday. Okay? Your exam is on Sunday. And good luck.